Hi, I'm Dr. Shane Howell with Alternative Health Management over here in West Houston, and so I'm going to demonstrate some of the self-treatment techniques you could do at home for kind of mobilizing, loosening up your hip, which a lot of movement should be coming from your hip, not your low back. And so by loosening this up and making sure this is moving properly, it helps everything like from the back and hips into even the knees and the feet. So usually what I recommend, these are things that I do personally, is I'll use a foam roller to kind of self-massage all the way around the hip. So the hip is right here. It's not back here, it's right here. So we want to keep really loosen up the tissue going in and out of that hip. So I'm going to demonstrate it on the table, but I usually do this on the floor. So I want to kind of work the hamstring. I'm rolling back and forth. And if you notice, I'm pivoting around, and I can get the outside of the hamstring and the inside. And I'll spend a good 30 seconds rolling back and forth. If it's more tender, I'll spend more time. Then I'll turn to where I get the iliotibial band, which is the side of the thigh. Just like that. Up, down to the knee, up to the hip. Another 20 seconds more if I hit some tender spots. Okay? Then I'm going to hit the front, the quad. And same thing, I kind of pivot around and get different aspects, because the quad muscle is 4 different muscles, hence the name. And then I'll go all the way up into the hip. Right, that little bone right in the front of your hip there, right below it. Just kind of rotate around it. Okay. I also want to be hitting the hip, or the glute area, which is the back of the hip. And what I do is I'll put my foot on my knee and kind of gets a good stretch position as I'm doing it. Just rolling around it a little bit. Okay. And then the last one, that's a little getting into position, but you put the foam roller down, you kind of you want to get the inside of your thigh. So I start just above the knee, roll back and forth. A good 20 seconds more if there's some tender spots. And usually I'll spend a little more time getting right up to the top of it and just kind of really digging in there. And I do this every morning. I get up early and do this every morning because it really loosens things up. Okay? Then what I do is stretch the hip. I'm going to stretch it all the way around. So I start with, you can do this on your bed with this stretch. Don't do the foam roll on your bed because there's too much give. Put my foot kind of like that position, and then lean as best you can into that bended thigh. And I try to get the pelvis and the hip, back of the hip below where I'm at. Now I'll sit there for about 20 seconds. Okay? Then I straighten the leg. I'm going to stretch the hamstring and the calf. So I try to grab my foot and pull my toes toward me and try to keep my back straight. Lean into it. Hold that about 20 seconds. Then I'm going to turn where I get stretch the internal part of it. It's called the adductors. Hold that. I'm just kind of lower into it as best I can. Hold that about 20 seconds. And then I'm going to turn about 45 degrees from there. So it's like in between those adductors and the hip flexor. Hold that about 20 seconds. Then straight and bring the knee towards below where I'm at. And kind of drop it and push my hip forward. Hold that about 20 seconds. Okay? And obviously do both sides. And I might do that 2 times around, and it really loosens the hips up before I do any other type of exercise. Go for a walk, go for a run, whatever. Okay?